Joining us now are two members of the team at Pure Balance Center. Welcome to you both. How are you?
Doing great.
Good. So, Dr. Michael, we got a chance to visit. And who did you bring with us?
Today and with us is Maciel Gomez. She is one of the new assistants in our office for most of this year, working on some of the new services we're providing.
It's pretty exciting. And you and I got a chance to visit too.
Mhm.
And so, what's so interesting is that the technology that you have, and you said that that excites you the most,
Yes.
right? So, you've only been at this practice for a short while,
Right.
since the early spring,
Right.
but you've actually been in chiropractic for a couple of years now.
Yes.
What made you decide to join Dr. Michael?
Well, not only Dr. Michael's philosophy on chiropractic and the more holistic approach that he takes to chiropractic care, but also all the new modalities that he's introduced. So, regenerative medicine is one, and there's a lot of different things that we're doing under the regenerative medicine. But shockwave therapy is something that's been phenomenal for the practice and the patients.
Now, shockwave wave therapy sounds a little scary, remember? Because like people used to have like those
Mm.
lobotomies and
Right.
things like that. Okay, so what exactly are you shocking and how does it work?
Well, the technology is based on a radio frequency. So the application of the energy, it actually looks like you're using the classic ultrasound, but it works like a little mini jackhammer. So a very light impulse is felt, but a powerful signal which treats soft tissue injuries.
One of the things I read about you too is that you also help like pregnant moms, not with that therapy, but other something called
Correct.
Webster. What is Webster therapy?
So Webster Technique is the analysis and adjustment specifically of the pelvis based on a unique finding that's most common during pregnancy. We might see it on other patients, but it's most common
Is that
for
like
our
hip
pregnant moms.
dysplasia? What is that? What is that? I'm
It's
just guessing. I have no idea.
specifically to
Okay.
the sacrum.
Oh,
So the
okay.
very foundation of the spine, we look for a lesion or what we call subluxation of that area of the pelvis.
And a subluxation is when your jelly gets squeezed, right? Like there's like jelly in between like your spinal cord. When that gets like pushed out a little bit, that's a subluxation, or when it's not aligned correctly.
Good question.
Okay.
So the simplest way of explaining subluxation is a separation from wholeness
Hmm.
for that human. To apply it to what it is within the body, you could say it's a misalignment of vertebrae. You could say that the effect on the nervous system, the tension or pressure that creates is the subluxation because that's the reason it's important. What you're talking about with the effect of on a disc would be a subluxation with a more complicated form of outcome or cause of symptom.
Okay. Got it. So you fix a lot of spines. You help pregnant people. You also have Pilates. I mean, this is like a center. When it says Pure Balance Center, it's like it's all encompassing,
Right.
right? So tell us about that part of your practice. What's going on there?
Well, the Pilates originally started with a franchise called IMX. They originally came to one of our state association dinners as a sponsor. They talked to me about implementing the use of this clinical program for rehab for some of our patients. Thought it was a great idea. I just didn't have the real estate for it. And within the same week, the tenant next door moved out, and it
Eureka.
was a godsend.
Yeah, it's like,
So we started with
ta-da!
this. It expanded to what we now have as a standalone fitness program, as well as a way to rehab patients using very unique core stuff. And if you've ever heard of Dr. Stu McGill, spine specialist out of Canada, he was one of my undergrad professors. His work is all in the course manual for IMX Pilates, so it was just meant to be.
It was meant to be. You help children, you help people with scoliosis. Like, what are the types of patients that you can work with? Is it run the gamut?
Well, we work right from birth.
Okay.
Some of our moms come right to the practice right from their birthing center
Mhm.
just for the well baby check. The well baby check is the most exciting thing to do because the natural effects of trauma from birth, both for the mom and the child.
Hmm.
The most common time to clear and the easiest time to clear these lesions through the most gentle touch. So people talk about, do newborns need body work? Um, it's very common, yeah,
Wow.
yeah.
And what has the result been? Do they tend to like walk faster? Do they stay healthier overall? Do they
Mm.
get less sick when they go to preschool? So if you start them young, is chiropractic care part of their overall wellness plan?
So we were taught that if you got checked from birth and had these lesions, these subluxations cleared regularly, then you might never need more than a monthly wellness check regularly throughout your life and maintain a healthy functioning spine without the decay, the deterioration that sometimes people call normal arthritis. We don't believe in that.
Okay.
It's common, but does it have to be to the extent that it is? No. So we check children and the outcomes. What are chiro kids like that are different than others? Guess how much money Big Pharma is spending on researching that? You're right, none.
Yeah.
And guess how much is in our profession to research that? Uh, Almost none.
Okay.
So the idea that case studies have value when they're put together in the thousands, but we're observing kids that do really well learning, reaching developmental milestones, kids that have powerful immune systems, and just the ability to play and explore and be raised in a lifestyle that just is not constant being drugged. This is a lifestyle where kids can grow up with this idea of playing in the mud, um, creating, being curious, and not being hindered with this idea that, oh, you're going to be sick. Let's take you out. Oh, let's let you rest. No, let's let these kids thrive.
Wonderful. I think it's great. Obviously, you're very happy there.
Yes.
Uh,
I bring my own children there.
That's just going to ask you as a mom, like you do. Okay. And is that part of the allure of like why you wanted to do this field is because you wanted to help your kids?
Yeah, I actually got more into the holistic care mindset, I would say, after having children. I was already kind of delving into it, but after having children and you're exposed to all of the things that you would think are helping, but are actually not as helpful as they should be and are kind of a little bit more toxic. That paved a way for me to really explore options on how to make sure my kids are always thriving through, through anything. And not only Dr. Magwood, but just chiropractic care in general has really, really helped them through things that parents would see as like a doctor's office visit to help, some antibiotics to help. A simple adjustment and being consistent with adjustments has prevented a lot of things and helps them through a lot of things.
Wonderful. I thank you both for joining us. I know that it's, like I said, it's very comprehensive what it is that you do in the center that you have, and continued success to both of you. And just like hanging out with you guys, I'm already like adjusting my posture. So there you go.
Yeah.
Chiropractic might be an opportunity for you to feel a little bit better. So take a look, whether it's this practice or anywhere from coast to coast, and we wish you well. Thanks for watching.